Well, I think the main factors that we looked at to acquire it, and then what we found since we've been using it, is that it's made our ability to monitor the units much easier, much more efficient. We like some of the capabilities in the product where we can monitor temperatures in cabinets and report on that all the time. We have a serious issue in the Northeast in particular with extreme colds and extreme heats when it comes to medication degradation and impact on equipment over the long term. So to be able to do that and to monitor and set up kind of parameters and targets that alert us to when there's issues and problems has been very helpful to us to know that we've got perhaps an issue occurring with a particular unit, that we need to get those medications out, replace them with better medications. That clearly is going to have a positive impact on the patient. In the old days, you would work in the blind and not know whether a particular medication had reached its limit of efficacy or shelf life because of the hots and the colds. Now we're replacing those medications when it becomes necessary. Another big advantage of it is that we can tag our more expensive equipment, and we can know almost instantly when one of our crews has accidentally left a piece of equipment at a scene or at a hospital and the vehicle is not fully equipped and ready to respond to another assignment, sometimes even before the crew realizes that. So that's a great advantage to be able to do that. Having a mobile hotspot has played really well for us in our electronic patient care records. Our ability to be able to communicate instantaneously from the back of an ambulance as our medics and EMTs are completing their call reports to the receiving hospitals. So they can, if they choose, to get access to that information, to be able to know as we're treating and transporting a patient inbound to a hospital, exactly what's happening with that patient, what treatment regimen has already been instituted, how the patient's doing, what their vital signs are, those kinds of things. That's clearly a benefit to patients and patient outcome because the emergency department staff is if they choose, informed a lot earlier. It's also just improved our ability to function administratively, being able to capture that information in real time and have it downloaded almost instantly during the process and when the chart is complete. Very helpful to us so that we don't have to wait for hours, sometimes days, to get paper charts back to the main office. And just cutting out human error. When you've got the technician in the field, that's a clinician in the field that's actually recording the information, and it's not going through multiple hands to then be data entered by somebody else who could misplace a decimal point or put a zero where an O was or something like that. That clearly can cause problems with data entry and screw up our process of patient information. And then in the end, to be able to do billing quickly and to streamline it with little errors to no errors will improve our cash flow and get our claims processed more quickly. That kind of is in a nutshell. I know that the tech staff has been very happy with the product. It's installed easily. It's very reliable. It works well. It's robust. Those are the kinds of things that we haven't seen in the past. And with this particular product, I know they're very happy with it.